The panel discussion is going to be around this new narrative or this new initiative, which is being led by the Surgeon General Saab, who is here, and MedAsk, the company, which is also represented here. General Imtiaz Saab is also here. So welcome, sir. Good to have you with us. And we've invited private hospitals as well to be part of this this conversation, how we can create an environment, and if we are ready for this inward medical tourism, which means that rather than sending patients outside to other countries, we invite patients to Pakistan. I would request our chair and co-chair to please take the center. Please. So I'll invite my panelists. Dr. Junaid, please seat. I saw Dr. Bashir Hanif. Yes, please, if you can take the seat. Dr. Abdul Bari Khan is also out there. Yes. Miss Andrea from UK, if we can have you. Mr. Daniel Ghinn from UK, if we can have you as well with us. And I don't think, Dr. Suhail Chughtai, please. Mubashir Saab, Dr. Mubashir from MedAsk. Please, Dr. Mubashir, please have a seat. Dr. Miraj from Aga Khan University Hospital, and Professor Dr. Asma. If we can, another one more. Ek yahan le aaye. So, Dr. Miraj, आपके लिए आ रही है? अच्छा, ला रहे? So this is a panel discussion, and which means that we would love to have questions from the audience as well. But I will drive this conversation. So we'll have the first round where we will ask all our panelists to give us a very brief, short introduction of themselves. So if we can have the mics from here. Please.
Hi everyone, Assalamu alaikum. My name is Dr. Suhail Chughtai. I'm an orthopedic surgeon based in London. I'm also a digital health strategist, AI and telehealth, certified from MIT, USA in AI, and also Microsoft certified in healthcare technology. I'm also fellow in clinical telemedicine, and I divide my time between orthopedic practice and digital health strategizing and making software and designing softwares.
Thank you.
Assalamu alaikum. My name is Daniel Ghinn. I'm CEO of a company called Creation.co. We're an insights consultancy for healthcare, and my particular interest is in health communication and the role of digital technologies for improving health communication and healthcare marketing.
Assalamu alaikum. Hello, everybody. My name is Andrea Green. I am a medical concierge headquartered in London, the United Kingdom. I'm a dual citizen as well, American-born. So yeah, it's a great honor to be here. I will be speaking about medical concierge and patient advocacy and helping patients come into Pakistan. Thank you.
Assalamu alaikum everyone. I'm Dr. Bashir Hanif. I'm a consultant cardiologist and executive director and founder member of the Tabba Institute.
Assalamu alaikum. I'm Dr. Junaid Shah here in the capacity as president of the Private Hospital Association. It's quite a large association. We have somewhat around 200 member hospitals across Pakistan. I run a 100-bedded orthopedic unit in Karachi for the last 40 years, and quite an experience in the healthcare. It's a pleasure to be here. I have remained health minister of this province many years ago, but I have been minister of various other departments in the government of Sindh. So it should be an interesting sitting. Thank you.
Assalamu alaikum. I'm Dr. Iftikhar Satti, and I'm doing as Surgeon General for Armed Forces Medical Services. With a background of more than 60 hospitals and more than 40,000 beds with us, all specialties, 13 institutes. And in fact, we are the sector who can provide quality with economy, inshallah. Thank you.
Thank you, Dr. Zaki. Muhammad Arshad Qaim Khani. I'm the Chief Executive for the National Universal Health Insurance Program for Pakistan, which is popularly known as Prime Minister Sehat Card Program. This is the world's largest National Universal Health Insurance Program, covering over 200 million Pakistanis. 6 out of 7 federating units of Pakistan, except my own province, Sindh, where I'm sitting now at the moment. And I'm a former advisor to the UAE government as well, where I did first universal health insurance back in 2006, I now recall, while I was there. Thank you.
Assalamu alaikum ji, Dr. Abdul Bari Khan. I'm the founding president of Indus Hospital and Health Network, which start from pre-primary to tertiary care hospital.
Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh, and very good afternoon. I'm Dr. Mubashir. I'm the head of MedAsk Medical Tourism Department, which is MedAsk Tours, and we are starting medical tourism in Pakistan. We have a medical city within 5-kilometer radius in Rawalpindi area, which Satti is looking into, and we are promoting medical tourism. Thank you.
Assalamu alaikum. I am Dr. Asma Faisal. I am professor in Dow University of Health Sciences and director for Institute of Business and Health Management in the same university. So I'm representing the academia.
Thank you. Assalamu alaikum and good afternoon, everyone. I'm Dr. Shah. I'm working as the Chief Operating Officer for off-campus hospitals for the Ghinn University Hospital. It's a pleasure to be.
Thank you very much for the introduction. So as you can see that we have a spectrum of, the panelists represent pretty much all of those areas which will be needed if we want to establish this inward medical tourism ecosystem in Pakistan. So ranging from academia to one of the largest not-for-profit hospital group, if not the largest, from the first JCI accredited hospital, which we showcase to everyone when they come to Pakistan, from the Hospital Association. So representing Dr. Junaid will be speaking on behalf of all the private hospitals, and we have a few guests from UK. Miss Andrea, who actually works in medical tourism as a medical concierge, so her perspective of how to handle patients, and clinicians, and Mr. Daniel, who looks at it from this other engagement and the digital side. So we have a good spectrum. General Satti Saab is the chair, and Arshad Saab is going to co-chair this session. So we've tried to bring all the stakeholders together. And why we wanted to do this, you must be thinking that this stage is a very busy stage right now. But one of the reasons is that this is an initiative which is just starting. So for the last so many years, even we have been involved in sending or referring patients from Pakistan to other countries, including Singapore, UK, even India. But I think this is about time, and thank you very much, General Satti Saab, for and Dr. General Imtiaz MedAsk, for really taking this initiative and creating this thought for Health Asia to bring everyone together and ask this important and difficult question, that are we ready for patients? And we had Ms. Andrea visiting Aga Khan yesterday, which perhaps is, mashallah, one of the best hospitals, presentable hospitals in Pakistan. So this is our question, and this is what we are going to address with your help. So to start with, I will ask Dr. Mehraj that what is perhaps the number one quality of a hospital which will attract patients from outside, whether they are expat Pakistanis or they are non-Pakistani? Number one.
Thank you, Zaki, for the question. If you ask what is the number one quality, I would say quality of care and safe care. This should be the top priority and is considered to be the top priority on that end where patients want to seek health care from any international hospital.
And how would you compare that with cost?
So quality has cost. Quality, you have to pay a price for quality. Quality is not free. Only thing which is free is non-quality or poor quality. So people are willing to pay cost or a price for quality care. That should be reasonable. And
yeah, so we start off with, and obviously that was a leading question, and this, again, as I've said a few times in the morning, perhaps my bias because I work in quality and patient safety. So we start off with that. So one of the important questions, so when we used to refer patients to Singapore, we knew that they are paying high cost only to get best quality. So I think we start with quality. I move to Ms. Andrea, and since you are in this business and you receive patients and you run a medical concierge, so what do your patients expect from you when they reach out to you and when you refer them to different hospital facilities? There's the mic.
Thank you. Thank you, Dr. Zaki.
Can we have the mic on?
Oh,
Yes.
I'm sorry.
It's okay. So mic on kar dein sare. On hai? Okay.
Thank you, Dr. Zaki. No, is it working? Thank you, Dr.
Yes.
Zaki. Okay. That's a really great question, and it's really the genesis of what I do and how I do what I do. It was so great being at the round table this morning and being able to get to listen to the specialists, the doctors, and everybody talk about what it is, where you're at, meeting everybody where they're at, and what you're going to do in order to implement better strategies, seamless ways of helping the patient outcome. And that's what I do. I get to come to events like this, and I get to go back to my clients, and I get to say, hey, listen, this is what we're doing, this is what we're working on, this is who I met. I've had tours of the hospitals, I've seen for myself, and I get to be the patient advocate. And I've helped to educate them on the best outcome scenario based upon what it is that they need or that they want.
So in your experience, what are the patients looking for? Are they looking for cheap services, or their requirement is quality as opposed to less cost?
I mean, I think that they want it all, really. That's usually the case. And it depends on the individual, on what they want and who they are, and there's so many variables. But of course, if we can always get it cheaper, then that's great. And again, as Dr. Shah was saying, it's quality of care. At the end of the time, they want to feel the best that they can, so.
Right. So moving to Dr. Bari. Dr. Bari, you run a network of hospitals, around 14 hospitals, mashallah, and you serve a different population. But you have a very strong quality department. You are a paperless hospital. And so do you think that your hospital network is currently ready to receive patients from outside? And would you be willing, and what is your take on this?
Bismillahirrahmanirrahim. Currently, yes, we are ready to, rather we receive patients from outside Pakistan. So many patients come from, especially for childhood cancer, we get patients from Afghanistan, Iran, UAE, Saudi Arabia. So we prepared for that. And the quality, basically, as Arshad said, it comes with money. It's expensive. It is expensive. And free is not quality. I differ. Basically, we are providing free, but it is a quality treatment. But it is the mindset of the higher management. And when we were setting it up, we said the benchmark would be where we will ourselves be treated. So if it is good for me, because all humans are equal, whether they are poor or they are well affording, so they need the same quality of care. So, and this is just not the buzzword. We had ourselves treated. My mother-in-law got a pacemaker implanted. My father of my medical director had surgery, TURP in that hospital. So we are ready, but the environment should also be ready. The security situations of Pakistan, that is important. Unless you don't have this, so we will not be able to have it. So I think so every hospitals are ready. Majority of the hospitals are ready, but it is the security situation should be okay for that.
Yeah, it's definitely the whole package, because especially when we say tourism, when we say medical tourism, and this is a question which is often asked, why do we link medical treatment with tourism? Because Turkey and other countries have actually successfully done it, and they combine both. So Dr. Asma, you are from the academia, and you run different programs, and you look at the industry, or you look at the trends. So what do you think as, as a teacher, as someone who prepares professionals? So what opportunity do you see here?
First of all, we all should be sensitized that there is something which is called smart hospitals, there is something which is called quality. So when we are exposing our own country to the quality, and we are projecting our hospitals as quality hospitals, then of course the patients from abroad, from different surrounding countries, specifically the SAARC countries, then and the quality care, and of course the affordable care. So then of course the patients will come, but we'll have to see that the quality comes with the professionals who are working in the hospitals. So the smart hospitals, since morning we are seeing that there's the future hospitals, then the smart hospitals. So the doctors which are trained here, and the patients they are receiving from abroad, and the patients who are well aware of everything that is being offered in their own countries. So if they don't get these things here in our country, this tourism will remain a dream. So we have to first of all train our own professionals, our own doctors, our own currently the specialists working in the hospitals. We have to train all of them. We have to actually inculcate the curriculum with all these informatics and big data and with all these sciences subjects, so that they'll be actually receiving the patients from abroad, from US, they're well aware patients. The patients are basically, they want personalized care. So if there is no concept of personalized care in our own country, and we are just running the hospitals with the conventional knowledge we had 30 years ago, then this would not be a successful venture. So we should always see that what are we teaching to our students, what are we training to the consultants who are running these hospitals, who will be ready for the medical tourism.
Thank you very much. So what brought us here will not take us there. That's the philosophy. Thank you very much. So I'll move to Dr. Mubashir, who's perhaps one of the most relevant persons in the panel from our side, who has been working in medical tourism, and he represents MedAsk. So please tell us why we are here, what are we trying to achieve, and how do you plan to achieve that?
Right. Thank you so much, Dr. Zaki and organizer, for inviting me to say these things about medical tourism. So basically, I started medical tourism in Malaysia in 2008 when I was part of the Prime Minister's list of people who developed it, and in 2010 we launched Malaysia Health Travel Council. That was in 2010. Ever since, Malaysian medical tourism industry has grown leaps and bounds. Today, Malaysia earns about 1.5 billion, around 1.5 billion US dollars through medical tourism. We know Thailand, we know Singapore being one of the pioneers in this industry, and they have earned huge exchequer overseas. And medical tourism is not just treating overseas patients. Basically, it is how you improve your standards of care while you are treating overseas patients, because you will come to know that there is an accreditation required. And this accreditation may come with the name of JCI or comes with any other name. You have to improve your standard of care. How we see in MedAsk, and this is not just a run-of-the-mill standard treatment or care we are providing, but we have a very well-orchestrated system behind it. So we have primed our hospitals, like we have 12 hospitals, 12 AFIs, Armed Forces Institutes, who have been told about it, how a patient journey will take place, how a pre-consultation before they arrive in the country starts with. So we basically take them through a very well-organized, structured approach. When they land, we take them to the hospital and they are seen in a very well way, like they don't have to wait for a long queue. And then after the treatment, we have proper follow-ups for them. Then we take them for, say, if they can do a tour or trip in the country, we take them to their favorite destination, which they have picked before coming to Pakistan. So all this, and then we have to see like how much is the stay, whether there is a complication, possibility of some complication which can occur within this, so all that. And beside all this, you just imagine, like we always pose a question in medical tourism, a ICU bed taken by a local patient or overseas patient for the care. So we have all these in mind when we set up medical tourism to bring hordes of patients. We say maybe a plane load of patients landing in Pakistan to get medical tourism. Pakistan is a great country. You know, Pakistani doctors all around the world are the leading doctors. In almost, you see in UK, US, Pakistani doctors are represented almost in all the top hospitals. So we see Pakistan is not lacking, or there is no dearth of Pakistani talent in terms of providing these treatments. In terms of hospital standards, we are, alhamdulillah, very well established. We have JC accredited hospitals, and more will be basically acquiring accreditations, and we will be looking into this, and we will establish it as a proper industry in Pakistan to thrive. And it is not just to like earn some quick dollar out of it, but it is to build the industry, build the medical fraternity, the mechanization, the proper techniques, the talent pool in our country. Thank you, sir.
So I think this is a great point. So if you look at, you know, all these countries, and so I've been to India many times to visit these hospitals, Apollo Hospital, Max. They invited me, and I was really impressed. And they had these floors, which they called Pakistani floors, so a lot of Pakistani patients, comparing them with Singapore, Thailand. But one of the advantages which you mentioned is that in the process, your hospitals become better. You know, everything, the quality of people, the quality of service, the quality of your food, as an outcome, the hospital goes to the next level. So I think that's a brilliant point that we need to keep that in mind. So coming to Dr. Bashir. Dr. Bashir, you're a clinician and also executive director. My question to you would be, and you have lived in the US, you still work in the US, you work in Pakistan, you created this cardiac excellence center, mashallah. Do you think that patients from other countries, whether they're Pakistanis or non-Pakistanis, would they just come to get treated by a very high quality expert physician like yourself, or would you need all the other paraphernalia and the hospital and, as we mentioned, the environment?
Thank you very much, Dr. Zaki. I think it's important to provide the quality care, no doubt about that. That is probably, I would still say that is number one thing which really matters to the patients. And in quality care, I can tell you from my experience, I think out of all that, empathy from the physician and the nurses is more important than anything else. Now, environment is definitely very, very important, no doubt about that. When we started the Bahar Institute, we used to get a lot of referrals. People from UAE and other countries came to even visit from my contacts, and they wanted to bring their patients. But unfortunately, again, the environment of the country overall, the infrastructure and the political situation, I think for a patient that is also important. I can tell you now, I had a lot of, from physician standpoint also, I'm telling you, I have a lot of friends in the US and different areas. They want to come to Pakistan to provide the services, but they even are reluctant to come to Pakistan for, unfortunately, all of us, the reasons are aware of that. But for patients, that becomes also very important. How safe it is to visit there, what kind of services we provide. I can tell you, at least in cardiology, alhamdulillah, we have been able to provide almost every service which is available anywhere in the world. The cost becomes a major problem. For example, new procedures which are coming up, which surgeons used to do, now we can do it, valve replacements and other things. But the cost becomes really prohibitive even for Pakistani population over here. So I think it's not individual effort. All of us has to work together, and obviously the government and the political situation need to improve before we really start getting patients for tourism. Again, I can say for sure, as I said, you know that also the Tabba Institute has been able to provide the best quality care, and I was the first one who voluntarily basically enrolled our hospital with American College of Cardiology, and we sent every patient's data to US, and we get a benchmark report every quarter. And for last 5 years, we have been achieving Platinum Award, and we come in the top 10% of the US hospital in terms of numbers and providing quality care. But still, we are not able to attract the pain. This fact is known, which is available online, on net, everywhere. But still, patients are kind of reluctant to come here and get the services. They know that there are qualified people and everything is there and quality services are provided. But I think it has to be the joint effort of everyone, individual level, institutional level, and government level, to promote the tourism and get more patients to come to Pakistan.
Yeah, so it makes sense that in addition to having brilliant surgeons and brilliant physicians, we need to have those support services. And I'm glad that you mentioned, so it reminds me of Dr. Codman. So Codman is the highest quality award in the US, and Codman was a surgeon in the US, and he talked about sharing data and sharing outcomes of your patients 80 years ago, 70 to 80 years ago. And he was considered as maybe a crazy person, and he was ostracized, but then he became instrumental in the formation of JCI. So thank you for letting us know, the audience, that we have a hospital which is transparently sharing the data and then getting recognized with the American College of Cardiology. So I move to Daniel. So Daniel, you give a different perspective. You work on social media, you work on perceptions, right? Your company is the largest company in UK and very established in that part of the world. How do you think this perception could be created or is built on the social media where everything is right now?
Thanks, Dr. Zaki. I think that what I'm hearing is that there's an element of trust. To what extent do patients trust the healthcare environment in any setting when they're going to go and visit a hospital, a physician, and so on? I think in terms of medical tourism, that's a huge opportunity. We study doctors on social media, millions of doctors all around the world, how they use social media to engage each other, how they develop trust among each other, how we actually measure that trust on their social media interactions. And that has a huge impact on patients too. So we see physicians sharing educational content for patients or talking about outcomes and so on. And I think when we talk about sharing of data or sharing of information, not that healthcare professionals will necessarily share, a private information about a patient, but they may talk about outcomes. They may talk about, the process. What does it feel like? What's the experience like to be in a healthcare setting? These kind of things are huge opportunities for building trust among patients. And I think there's a great opportunity for healthcare professionals in Pakistan and healthcare providers and hospitals to play that role on social media, to actually collaborate effectively online, to do that in a visible environment. I mean, the beauty of social media is it is so public. So people see it, patients see that interaction going on, they engage with it, they they benefit from it. So I think that's where, that building of trust, that showing of empathy, that establishing credibility is a huge opportunity, which I think has professional benefit for healthcare professionals, but it also benefits that patient interaction. In the US, I was listening to some healthcare professionals online recently asking each other on social media, should we put our social media impact metrics on our resume? Because hospitals may want to employ us if they know that we have an impact on social media. And I think that's a different way of thinking, to think that hospitals might think we want to employ doctors who are already making an impact on social media. Perhaps those healthcare professionals have got a role to play in the overall brand and trust that is established with the hospital.
Great. So I think, as you mentioned, visibility. So like Dr. Bashir said, so we have this hospital, they have all the accolades, but do people know about it? So maybe we need to have more visibility of the brilliant work we are doing, but people don't know about it. So thank you for that perspective, and I think this matrix or the index which you mentioned, yeah, this is a nice idea. Yeah, thank you for that. So Dr. Suhail, so you have this opportunity. You're a Pakistani, you were trained in Pakistan, and now you are an orthopedic surgeon in UK, but most of the time you are seen in Pakistan. So obviously your heart is here. So how do you connect technology to medical tourism, which we are all trying to figure out?
Yeah, I think every process has what, why, and how, and my work and strength lies in how. How can we make it happen? The process. I have operated in Pakistan, joint replacement surgery, and I'm doing it in the UK now. And I see a difference. In Pakistan, the process involves, in some places, surgeon doing even the dressing. And that is what the patients don't expect from UK, at least. They want everything specialized. A nurse taking blood pressure, she knows how to take the blood pressure. A blood person taking blood sample, he or she knows how to take blood sample. So that degree of specialization is pretty critical, because patient is watching, not just having treatment. So they go back home and they say, well, look, I got a great treatment there. Everybody knows what they're doing. So that's one part. But most important part is, as Daniel also said, how to attract people. And I think there should be a digital triage. If you know, Nafees Zakaria was the ambassador of Pakistan in the UK, and I discussed the digital triage. I showed him a design at that stage when COVID was happening. And he agreed with that there should be an app searchable by a problem for overseas Pakistanis who want to come to Pakistan. They're on the long waiting list. They can't afford it and have private healthcare in England. So there should be an app searching the problem, and this digital triage online comes first. And that is how the process should start. Then the people should register, upload the documents, get the right person, right hospital, and then the process starts. But that's not where it ends. That gives the confidence to the patients. When the patient comes back home, England, they still have an app applicable and do the follow-up for basic problems. So that digital app connecting the patient up to the finish of treatment back home as well is critical in the process making. And I suggest that this should be given a consideration. Once what and why is sorted, how is where it success lies. And AI, telehealth, virtual home care, they are making it possible. Thank you.
Thank you. So this idea of using technology. So when we were doing medical tourism, obviously the other way around, we were facing the challenge of the follow-ups. So patients were going to Singapore, they came back, and then what? So since we were working in telemedicine as well, so we created this e-referral process so that patients, even before they go to Singapore or India or Turkey or any other country, they have a pre-procedure engagement, and then when they come back, as you mentioned, so using technology, whether that's an app, a website, but I think that's something which has to be done. So now I move to Dr. Junaid. Now Dr. Junaid obviously brings many different perspectives. So he's an orthopedic surgeon himself. He's the son of the king of orthopedic surgery in Pakistan and an avid cricket fan. Suhail, you must know that. MashaAllah, may Allah bless him. And he's now also a producer You can have this offline conversation. I will not tell you what is he producing, but you can talk to him. And I actually was there 2 weeks ago, saw that again. And he's also representing this private hospital association, and he has been in the government as well. So from all of those, experiences and perspectives, do you really think that we should even go for this maybe big, hairy, or audacious goal, as Jim Collins, says?
Thank you very much for having me here. First of all, we have to realize that, of course, these are all random people having random thoughts. So I think what Pakistan needs is a collective effort, and everyone needs to come under one roof and identify the problems and then go for the solutions. It's wonderful. I agree with every single speaker that has spoken here today. I think Irfan Saab sitting there has made one of the best speeches today, and I think we have a lot to learn from him and his whole setup in Kenya and Nigeria. I think the other thing we need to realize is that of course, healthcare we cannot compromise. The quality of care has to be there, but how do we keep it with an affordable pricing range? And I think we need to realize that Pakistan is probably the only country in the world where healthcare is not identified as an industry. And I tell you, if healthcare is not considered as an industry by our federal government, and we are all struggling to try and convince them that healthcare is a big industry, it can attract a lot of tourism, then we cannot reap the benefits of being an industry. And what are the benefits is all the services are not subsidized. Our private hospitals have to fund ourselves, and then we have to extract that input of money from our patient that is not necessarily in the socio-economic bracket that can afford our treatment then. And then we say we have to have the best robotic surgery and use AI and use social media and all these expensive tools, while in the end, if you think about it, the patient has to pay for all these services. You can make a fantastic looking building, you can make a 7-star hospital, but I think if the patient can't afford it, then what's the point of it all? So we have to somehow work towards bringing the cost of treatment down as well. And of course, not compromising. It's not a hotel. You can go to a hotel once. If you have a bad experience, you won't go there again. But if you go to a hospital once and you have a bad experience, you might not be in the world to go there again. So we cannot compromise the quality of care, yes, agreed, but we also have to keep a cap on the pricing. And I think the first thing Pakistan needs to do, and I've been trying for the last few years, is to identify healthcare as an industry. We have a lot to learn from Turkey. I think, if my figures are correct, they did some $53 billion of tourism last year. And out of that, 10% was health tourism. So that equates to around 4 to 5 billion of health tourism in 1 year in Turkey. Compare that to my province, Sindh, where we're sitting now. The budget of last year of Sindh was around 500 billion rupees, Pakistani rupees. That equates to around $1.3, $1.4 billion for the whole province, for all the government hospitals, for hospitals like Indus who get their funding from the Sindh government as well, from various setups, but the total budget was 1.3 billion. Now, if you compare that to Irfan Saab's speech, and he said that his own private network is around $1 billion, which is, I think he said, 8 hospitals in Nigeria, Kenya, and Pakistan. But you have to realize that this whole province's budget is comparable to one setup's budget. So there is an issue of funding, and without funds, we all understand that there's not much we can do. We still have to provide optimal health care, and we still have to manage somehow in the limited budgets that we have. But yes, it's a great dream. Yes, we have some great surgeons in Pakistan. Yes, we have some beautiful institutes like NICVD, like Indus Hospital, like Aga Khan Hospital, like Liaquat National Hospital, like South City Hospital, like Zakiuddin Hospital. There's many, you can keep naming them. But and it's a mix. Some are government hospitals, some are public-private hospitals, some are totally private hospitals, and they have their own dynamics to follow, and they have their own ways of funding their institutes. But you have to realize that there are limitations, and till Pakistan recognizes healthcare as an industry, there will always be these limitations. So yes, fantastic. Let's make our hospitals great 7-star hotels. There's no lack of clinicians in Pakistan. I actually have worked across the globe. I've worked in 4 or 5 different countries in my lifespan as a doctor. I think I find in Pakistan we have some of the best clinicians because we know how to deal with these extra topics as well, with the socio-economic climate as well, with the effects of terrorism as well, and with the security of our provinces and our cities as well. So there's a lot of other things we have to deal with as well. Like my friend here mentioned that it's important to see the security situation of Pakistan and how do you attract these foreigners to come to Pakistan. When you go to Turkey, for example, for a hair transplant, it's more like a holiday. So they do have the hair transplant, but they enjoy the rest of Turkey as well. Can we provide that in Pakistan? I think it's still a little immature. We have to set our stage first and then go for health tourism. But I'm a strong believer of health tourism, and I think it can contribute greatly to our exchequer. Thank you.
Yeah, thank you. You've brought a different perspective because of your background from the government and regulation and facilitation and providing that conducive environment is definitely necessary. So Dr. Miraj, Khan University Hospital got JCI accreditation around 20 years ago?
Yeah, 2006 was our initial.
Okay, so 18 years ago, yeah. Right? And I know that you receive or you have been receiving patients from abroad. So what has been the experience of Khan which you can share with other hospitals? Do you still have this formal service, or you just receive patients if they come?
So the process that we have, I won't call it a full form of medical tourism, but it's a good example to begin with. And we have been doing this for decades, right? Our referral network from UAE, Dubai, and especially Africa, Afghanistan, and surrounding region is there. It's not on a very large scale. These are small numbers, but over the years, these are coming up. And we are setting an example. But yeah, if we see the holistic picture, what my learned colleagues have already spoken, I'm not going to repeat it. I mean, you have to fix all the things together to do this. Whether the country, whether the region is safe to travel. I mean, the first thing that comes to anybody's mind, I'm going for healthcare. I'm not going for something else, right? Terrorism, law and order situation, affordability, quality, and this experience of AKU, I mean, within our small scales, have been very, very good. So anybody interested, we can have offline discussion. We have Sanobar with us here from our Marcom. She can tell you more about it. But we have learned from their experience, and we think this is doable, provided that we all work together as partners and put the complete picture together.
Right. So this reminds me of, South American countries, which are big in medical tourism, but they're not very safe countries. So there are a lot of patients who go from the US to Mexico for dental procedures, and Brazil and other countries. So Andrea, since you are in this space, what would be your take? Because when I talk about these South American countries, Turkey obviously is very, very safe. But I don't think South American countries would be in that category. But still, millions of patients are going there. So what is drawing them to this place, which may not be the safest city in the world, but still Americans are going there?
Yeah, absolutely. Thank you so much, Dr. Zaki. In my humble opinion, what I believe it is just process of numbers. That they've seen that, the majority of people have gone to South America, to different places for surgeries, aesthetic, cosmetic, dental in Mexico, and the majority of the people are okay. But I would just like to present a flip side for Pakistan. as a Western woman, blonde, blue-eyed, being here over the course of 48 hours, I've seen nothing but just the nicest people, and I have felt safe, and I have felt welcomed, and I have been welcomed. And Pakistan has so many beautiful places to see in regards of tourism. And embarrassingly enough, I didn't know until last year maybe that the K2 is here, that the mountains that you have, and the lakes and the regions, the food, the cultures, and there's so much to offer to to travelers and to people, and people are becoming aware of it. And I've been watching the YouTube videos and things, and people are coming here. So I truly believe that it is the right time and it's the right place, and it's just about presenting that right.
Right. So, and that's why we invited you to be part of this conversation, and so grateful for you to come and make this short visit. So when we start something, obviously, it's a, like I said, big, hairy, audacious goal. And as someone said, we keep dreaming. We need to convert that dream into a reality. There's a lot of work required. It's not going to be easy. But today we have started this conversation, and we have realized that there are, limitations. The reality is perhaps maybe much more different than what we have expressed here formally. But still, if you go to India, I think that, like I said, I go to hospitals. There's the environment inside the hospital is different, but when you go outside, it's pretty much like Pakistan. But with the vision, so Apollo Hospital was established by Dr. Devi many years ago, and when he started that hospital, the vision which he had was that this will be the largest hospital in Asia, and he made that. So I think we can also do that, inshallah. There are other examples. So coming back to Dr. Bashir, again, since you run a center of excellence, and cardiac services perhaps are the #1 services which are sought by patients, whether it's pediatric cardiac surgery or adult. So what do you think you would do to prepare Tabba Heart Institute to receive patients formally? What would you advise your team to do? Other than the external environment, what would the hospital change in order to receive a patient and serve him or her in the best way?
I think first thing which you already mentioned, it's important to let people know that that kind of quality services are being provided at international standards. And then secondly, obviously you need a team of people. It's not somebody, as I said, if somebody walks to the hospital, I'll be able to provide the best service, but it should be facilitation. Just like you mentioned in Turkey, people go for like kind of a visiting for hair transplant or whatever services. But I was talking to one of my friends who went there. They basically, the time you move from Pakistan till you land at the airport, then the way they are taken to the hospital, hotel, and all the tourism of the city, and then that particular procedure part is maybe whatever, an hour or so. But rest of the time, the whole team is really working, making sure that their visit to, for whatever reason is there, is very pleasant, and they remember that. And that's what is needed, which again, I think we don't have that kind of team, or we can definitely train and make those arrangements and everything. But again, I think, as I said, I had several people, several companies who visited in the beginning, and they wanted to bring the patients, but when they looked at the environment, unfortunately, no one did, except those Pakistanis who are abroad. They definitely want to come and get their procedures done because the quality or cost. Cost is obviously one of the major issues which Dr. Junaid aptly mentioned. But I think we need to have a team and make sure their visit, other than that particular medical treatment for the family and the patient, should be pleasant one, and they facilitate as much as possible so that they don't have any difficulty coming here and going back.
So maybe as you mentioned, the low-hanging fruit strategy would be to prepare ourselves for at least the Pakistani expats to begin with. because that's the easiest, and then create the word of mouth. So, I have this brilliant experience. I live in wherever I live, and then I go back and then I convince others. So I think the low-hanging fruit strategy. So Dr. Asma, please.
Everybody is actually portraying their part, and it's really wonderful to hear good things about Pakistan and their dreamy tourism. But this is all collective efforts. That somebody said that it's collective efforts. Yes, the patients who are coming here, they come here for big names, of course. Maybe Dr. Bashir, Hanif, maybe Dr. Junaid, but they come for the affordability. But of course, they come for the quality also. They would not like that they are coming here because there are so many US patients who are coming here for hair transplant and for dental extracts and for the skin care, and they get good quality also. They are getting treated also. So it's there, but it's not an organized effort. The tourism is there. And I can mention so many patients who are coming here, and every month I've been receiving patients, but it's not a tourism effort. They just come here because they are Pakistanis.
That's not structured.
So, yes, that's not structured. So it's not the Pakistanis living abroad, coming here, just staying with the parents and then getting the things done. It should be for all the, at least for the SAARC countries, for Bangladesh, for Nepal, for Bhutan. So these are smaller countries, right, which are, they may be very much attractive with the cost also. But of course, the quality and the accreditation of the hospital, the websites of the hospital, the apps, everything makes a collective big plate, offer, the offer in the plate. What right. are you offering actually? So this is a collective effort, and specifically, my colleague just highlighted that the experience from getting the plane, from getting out of the plane till the patient, and they club their objectives of not getting the treatment only, but have the essence of the country and going for shopping and going for other tourism places. So this is just an experience, the right. whole complete experience.
Right. So Dr. Bari, you are, mashallah, a visionary leader. You've seen all the sides, and you work very closely, not only in Pakistan, but you actually, you're traveling and you interact with associations, physicians. What would be your take, when you have learned that, okay, this is an initiative which is starting? What advice would you give from your experience? So please,
First of all, the intent. If we don't have a niyat, okay, we have to do it. If you make a conviction, and it is not only the hospital, it is from the state, start from the state. Mm-hmm. That is important, and there are a lot of opportunities there. So, because UK people are looking for avenues where to go and operate, get themselves operate. And if we cannot use that opportunity, it's an opportunity which we have to create an opportunity within our country with the government, and we have to tell them there is a lot of opportunity into it. So we have to do that. Then it can be.
Okay, good advice. Dr. Mubashir, since it is your mandate at MedAsk, and MedAsk has taken upon itself, and General Saab is also here, which actually shows your commitment. And General Satti sitting here again tells us that you are committed, and inshallah we will see results, maybe in a long time, but we will see results. So what is your strategy? Maybe in 1 minute, 1, 2, 3, what are you doing?
So basically we have orchestrated a system where how to bring a foreign patient, may it be overseas Pakistani or a foreign national, how he comes to us, and through a proper channel where we will take them to a hospital, get them treated, take them to a destination, visit Pakistan, and then send them back. So strategy of promoting Pakistan in a nice way and highlighting the excellent medical services, the hospitals we have, the care quantum we have, and all those stuff. So that's the main goal behind our thought process.
Right, and then you are developing a system as well.
Yeah, so basically it's all about system. Medical tourism
so if a patient from US wants to come, they know, who to contact, where to register. So,
Absolutely.
Right.
So how to register, and we have basically set up the process of it, like when from the first point of contact, how to channel them to a doctor, and when they land, how to take them to hospital.
Yeah.
Once they complete their treatment, how to take them to, whether we have to take or not to take them, and how far we can take them for a destination to a trip, and then when to send them back, when will they have follow-up, how to get that follow-up. Maybe they may have to come back to Pakistan.
Right.
So all that is very well thought and developed into
So we
this.
would, next year, inshallah, when we meet again at Health Asia, we would definitely invite you, and we would ask you about your experience and the learnings and the challenges as well. And obviously other hospitals can, learn from you. Daniel, what advice would you give, hospitals? So Irfan Saab is sitting here, Hans is building this brilliant hospital, So what should we do in 1 minute?
I think that the opportunity is to, particularly because of the global audience of patients who are on social media, I know this is my area that I'm passionate about, but I think that's where the huge opportunity is. Get online, use social media, connect, and create great content. So many doctors are now great content creators, and tap into that.
Great. So Hans, you'll have a team who will be working and doing that, Irfan Saab and others. Okay, so Dr. Saab, you are sitting in UK, and I know you're very well connected with the community and your heart is here. In 1 minute, what can you do to help us?
There are lots of Pakistani diaspora organizations like British Pakistani Foundation, World Congress of Overseas Pakistanis. I'm on the board of both and chairman of one. And I think they talk a lot about how can we solve problems. And Pakistanis contact them that I'm on the long waiting list, what can you do for me? So that's one area. Getting acquisition or control or support of Pakistani High Commission for the marketing is another area. But I think the most important thing is the consultants who are working there. Like patients come to me and say, I got 18 months of waiting time for knee replacement. What can I do? I should be able to tell them, look, there is a service available without being any conflict in with NHS. And that is what I have to sort out before, that is there a conflict for me referring a patient to Pakistan who's on my waiting list? Especially if I'm operating in Pakistan, if that matter is yet to be solved, if that gets solved, we are happy to refer patients to Pakistan from our list on the WhatsApp or whatever, and that is only possible when the legal issue is sorted.
Yeah, good. So, Ji, Bari bhai, ये mic on कर दें, please. Ji.
We have to be realistic also. Basically, the facilities available in Pakistan are not only enough for indigenous population. So, what to talk about inward? If you ask me, for Indus Hospital, we are prepared, but we have a long waiting list.
Yeah.
We don't have beds available, and there are many people who don't. For indigenous population, we don't have enough bed, so the government should realize it. If we have enough extra bed, then it can go down.
So building or creating new capacity. Dr. Bashir, one-liner, anything you want to add?
I think most of the things has been said, and we must continue to strive for it. Everything is possible. When I started Tabba in the most politically kind of a disturbed area, everyone used to say nobody will come here.
Right.
But we started getting patients very soon because we were able to provide the quality and affordable care over there. So just like we say, 1,000-mile journey starts with the first step, and this is the first step you have started, and I think we should keep discussing. We need to involve institutions just like today, and also the government to really create that kind of an environment. And we should keep trying whatever we can do in individual capacity as well as institutional capacity to promote that.
Right. Dr. Junaid, again, since you not only represent AO, clinic, but you represent 200 plus hospitals. So what would you advise, or how would you prepare, how would you take this back to your association and your members?
I think, again, like I said before, it's a collective effort, and I think Dr.
या ये इसको प्लीज देख लीजिए. जी चल गया. Too many mics.
Sorry, yeah, juggling between the numbers. I realize there's a number 8 written here, so whenever they switch 8 on, all the 8s come on, and then whenever they switch number 2 on, number 2s come on. Anyway, so I was saying that it's a collective effort, and Dr. Chughtai mentioned a very good point, which is the waiting list in the UK. I have worked in the UK, and I think that's the most painful thing, especially as an orthopedic surgeon, when you're waiting for a total knee replacement, a total hip replacement, and you're literally bedbound, but you're still told that you have to wait a year till your surgery. So I think we have to encash on that fact. Cost-wise, I'll give you just one example. Because Pakistan is not a great producer of surgical items, so even in my hospital in Karachi, we're using Johnson & Johnson and imported implant. So the cost is almost the same. So what is it in England? You do a total knee replacement for around 8 to 10,000 pounds. 80,000. 80.
18.
Okay. 18. That's what I thought. I was about to move back to England if you said 80,000. Okay, so cemented is around 18,000. I should think in Pakistan, including the travel costs, the accommodation, the food, the treatment, the follow-up, and then the recurrent follow-up if they're coming back to Pakistan again, say in a year's time to see the same surgeon, because in medicine you have continuity of care as well. So you want to see your surgeon, you want to see the same physician again. So I think the cost would sit around 10 to 12,000 pounds if you even brought it down to a bare minimum, because we're using foreign implant. We're still paying in dollars and euros and pounds to buy that implant, to buy that cement that we use. We don't manufacture that implant, we don't manufacture that cement in Pakistan. So the cost is okay, maybe a few £1,000 difference, but I think it's the waiting list that we can encash on, because like Dr. Bari also said, he's got a huge waiting list at Indus Hospital, which only goes to show that there's still appetite for opening new healthcare facilities in Pakistan. But collective effort, and I'd say that if all of us sit together and identify the problem, and I always say this is not a speech, but I'll still say it, but I always say in most of my speeches that a psychiatric patient first has to agree that he has a problem, then he takes the treatment and then he becomes better. So we also have to agree that we have a lot of problems and issues in Pakistan. We need to come together, identify the problems, and then go for the solutions.
Just a very quick comment. UK cost, you mentioned it's like 18,000, but I can tell you in US, the costs are phenomenal. For getting a bypass surgery, it will cost around $50,000 to $60,000 if you have to pay. Now, Medicare, Medicaid is totally different story, but if you have to privately pay them, it's $50,000. Same thing is angioplasty. Over here, I can do angioplasty with one stand, maybe 5 lakh rupees. In US, it will cost me $50,000 or $60,000, which is huge. Yeah, and you can cover all the expenses and angioplasty without any
more
problem.
Than 10 times.
Or bypass surgery 10 times.
So definitely the cost is low. So now we are, ending this conversation. We'll just take a few questions and then we move to. So what we are going to do is we will have the speakers and the guests will move to the lunch area where the Surgeon General will actually sum up this discussion. And before that, we'll just take 2 questions, if you allow. So, one question, you've raised your hand.
I would just like to comment.
A question, please. हाँ, वो short time short है. अगर question है तो बताएं, वरना short रखिएगा.
The question is that the iatrogenic morbidity and mortality is prevalent across the world, and luckily we are not leading and not even in the top 10 as far as the data is concerned. So why we are so shy and not confident of being safe and providing quality care to our patients?
Okay, so that's a comment. Thank you. आपका question है जी? नहीं. Comment. जी. हाँ चलें. एक last question and then you can be part of the discussion. जी.
Thank you very much, sir. My name is Mohammad Waqar Bhatti and I'm a health journalist. It is good to see that we are discussing health tourism and bringing people in Pakistan at the time when people are going to India and Turkey and many other countries of the world. But how can we attract people from outside the world when we have so many problems? Like we are having the issue of brain drain. Our doctors, young doctors, are immigrating to for the greener pastures. Secondly, the quality of healthcare education is declining day by day, and you know it better than me. Secondly, there is an issue of nursing care. We don't have quality nurses here, and if we launch this project, we start bringing patients here, and mishaps are starting happening, this will backfire. And then we don't have quality technicians, we don't have quality paramedics, we don't have labs. We send specialized labs, we send the samples abroad. So these are all the issues, and I want this esteemed panel to comment on that. Please, thank you.
Can I say something?
Gigi, please, and then we'll close.
Waqar, great points. But I can tell you again, as we have discussed all those problems, everyone mentioned those problems and why we don't have tourism. But I said, we have to take the first step. And there will be problems. We always had problems since 1947, and we will continue to have problems. But we have to together work hard. Nothing is impossible. If you keep trying, we are discussing. There are key leaders sitting here. They can, next step would be they can talk about it and see what can be done. Education, nursing care, and all those things is possible. And I'm telling you from my own experience, you have visited Tabba and similarly Aga Khan, and there are other centers also. They are centers of excellence, and the nursing care or physician care is excellent. Similarly, medical education at Aga Khan or other, there is excellent medical education over there compared to any of the international standards. So all those things can be done, improved. We need to work hard, and as everyone said, we need to work together. And that's the only way. And then if we work together, we can approach government and try to see what we can get from them, facilitation from them, and that's how we'll be able to do it. If we say there are so many problems, we can't do it, that will never happen.
And not just that, almost every country in the world who went into medical tourism, they had almost similar problems. So Pakistan is not new to this, starting with this. India, you just see 20 years behind, they had the same issues, but they are leading the world now. They have $10 billion a year revenue coming through medical tourism. This industry is going to be $240 billion in next 7 to 8 years. So where are we? We are not even starting. We have to start and bring it to the leaders in the medical tourism in the world, inshallah.
Doctor, we have started with your support. Alhamdulillah.
Thank you, sir.
Just, Dr. Zaki,
we have to close, please.
Okay.
Please, I'm so sorry. So our chair and co-chair will actually lead the conversation over lunch. Arshad Sahab, aap or Satti, please. So we thank all of you for being here. In the interest of time again, we are running late, and to facilitate everyone, we'll just have a group picture together, and our guests are requested to go for lunch. The lunch is ready, right? So the audience can go for lunch, and our speakers, our panel speakers, please stay with us. We'll have a group picture with the shields. Thank you very much for being here, and inshallah next year we will again have this conference, Future Hospital, in a much better way with more speakers. अच्छा आप देना चाह रहे हैं ठीक है सर जनरल साहब wants to say something please
Bismillah, thank you Dr. Zaki. In fact, what I wanted to say was with your first question to the audience, and that was what a patient need from our sector. Patient need quality with some economy. Like any consumer, he needs quality with economy. And you know what our country is providing to our patients and our diaspora from outside? We are providing, at least when I am talking of hospitals from armed forces medical services, we are providing first world treatment at third world price. And second, which was more prevalent during our talk over here, was situation in the country. You know, when I was coming to attend this meeting last night, I just opened a Google page about the news, and there was one news showing that the total number of people dying out of misconduct in this country was 700 last year. And the number of deaths out of misconduct in Chicago was more than this. You know what we are propagating? We are not propagating positive vibes to the world. We are propagating negative vibes to the world. We have got so much to sell. We don't know how to sell ourselves, our products. You know, when you get into internet, most of the news for Pakistan is disseminated from outside Pakistan. It is not from our sources. And the world now is driven by social media. What social media says, and you know what happened 2 days back, a false news on the social media erupted, and everyone wanted to sell it to the market. And what happened in Lahore? And the same goes with the single news erupting from Lahore and what happened in UK. We have a lot to sell. We have got the best doctors with us, the best available high-end equipment with us, and the best of all, the empathy. What I am seeing, empathy. We don't have empathy. Okay, just go with the news, any foreigner traveling to Pakistan, and you know what they say? The best thing with Pakistanis was their good nature, and they don't charge us. When we tell them that we are from foreigner, they don't charge us. Just get the best out of us and disseminate it to the world that what we are having. Please do it. And you know how credibility increases? When we get hold hand of a person and tell him, let's walk together. Let's walk together. All of us sitting over here, I met them just for the first time. I didn't met them on physically, and they are the names in my country. There's a big disconnect between us. So please, let's get together and go with the good. And I think that we can make this thing happen. Like, no one knows that what we can provide. Now I'm heading an organization with more than 60 hospitals or 70 hospitals, 13 institutes, Armed Forces Institute of Cardiology, Urology, bone marrow transplant, and things like this. And no one knows. Please just World Medical Education visited us because they wanted to, they just wanted to visit few hospitals in Pakistan, knowing that what we are doing. And they visited our military hospital in Rawalpindi and combined military hospital in our Armed Forces Institute of Cardiology. And you know, it was a very extempo visit, and it was just an unscheduled visit. And they graded us 99.4 out of 100. So we have got good things with us. Please let people know outside this world. And you know, when a patient comes to you, he don't come like a patient who is suffering with some chronic kidney disease. He don't come here for a visit or sightseeing. He just want to come, treat them in a matter of days, and they will just leave. Sir, thank you very much. Grateful.
बहुत शुक्रिया जी, बहुत शुक्रिया. And please, thank you everyone. Thank you, Janal Saab.
आपकी ज़रूरत है तो मैं भी यहीं समराइज़ कर दूँ, 1 मिनट लूँगा।
1 मिनट ले।
मैं ख्याल है कि जो बातें मुझे करनी थी वो सारी सत्ती साहब ने कर दी हैं। अगर मैं एक जुमले में समराइज़ करूँ आज की सारी डिस्कशन को, ऑल वी नीड टू डू इज़ विजिबल, एंड टू एंड, कस्टमर सेंट्रिक, अफोर्डेबल हेल्थ केयर सर्विसेज that we need to ensure.
Thank you very much.
And believe me, one thing I would like to say, हमें सुई बनानी नहीं आती, but we are selling aeroplanes to the 5 countries and another 3 we are under discussion. हमारा health system अच्छा नहीं है. We have a poor economy, but we have fight better than rest of the world against COVID. I am dealing with 1,000+ hospitals on my panel. They are wonderful hospitals. हमें अस्पताल बनाना नहीं आता, but we are running world's largest national universal health insurance program. Believe me, as British proverb very famously says, better do than perfect. All these are wonderful doctors, sitting experts left and right. People know how good Pakistani physicians are. All you need to start it now. Thank you.
Thank you very much. Thanks for those closing remarks.